About 1 in 3 adults right here in the U.S. have high blood pressure, and only about half of those people have it under control. And there are many people living that are unaware that they even have a problem. Here to talk about how you can control high blood pressure is Dr. Rachel Berger. She's a cardiologist with Virginia Heart. And, you know, this is really important because, as I said, people don't know. They think they're okay, unfortunately, until something happens.
You're completely right. It's called the silent killer for a reason. Most people don't have symptoms when they have hypertension, and they don't know it unless they go and actually have their blood pressure checked. And it can lead to all sorts of problems, problems with your kidneys, problems with stroke, heart disease. And unless it gets treated, it can lead to a lot of serious complications.
I think some people think that unless you're in a certain age bracket, do you need to start worrying about these things? But what is the truth of the matter?
The truth of the matter is it can affect you at any age, and unfortunately, with the rise of obesity and overweight children, we even see it in children.
Even in kids?
Even in kids. We see it in kids, we see it in young adults, we see it in people of all ages.
Now, if it's starting as young as kids because they're overweight and that being a primary factor, is that something they're going to carry on the rest of their lives?
Oh, they can make major lifestyle changes early on that can affect them for the rest of their life. And I talk to my patients, young patients, older patients, about different things that they can do in their life to make changes to control their blood pressure.
It's just daunting. I mean, I know that the stats show that overweight people in our country, those stats are going up, and a lot of it is our children. But to think that, you know, these things are really affecting their lives when they're that young,
Absolutely.
So hard to hear.
Absolutely. I mean, things like eating a heart healthy diet, cutting out the sodium in your diet. Our diet in America is so filled with salt and sodium, and that directly affects your blood pressure. So, you know, I talk to my patients about cutting out processed foods. Convenience foods are filled with sodium, deli meats, frozen dinners, canned foods, things like that can really increase your risk of hypertension. And by controlling that, they can actually get their blood pressure down.
Essentially, the things that are easier for us are hurting us.
Absolutely.
It's like we can't win here. Now you brought your equipment here, doctor. You're going to check my blood pressure to see how I'm doing, and we'll see. I'm a bride to be, so who knows what my blood pressure is right at this second.
Well, you're right. Stress does affect blood pressure, and blood pressure fluctuates throughout the day. So sometimes you'll have normal blood pressure at one time, and your blood pressure may rise throughout the day.
Yeah.
So it's important to get your blood pressure checked, and we say that people should have their blood pressure checked at least every 2 years after the age of 20, and as
every 2 years after the age of 20.
At least, and as you get older, it should be more frequent.
Now, you know, they have these places, you go to the pharmacy in Target or Walmart, and they have those little check zones. Are those accurate enough, or go to a doctor? What do you say? You know what I'm talking about, those machines?
I know what you're talking about. Your blood pressure is just fine.
I'm fine? Okay,
you are
great.
Just fine. So people always ask me, what a normal blood pressure is and where they can check it. So some people have home monitors.
Right.
Those tend to be pretty good. We advocate for the arm rather than the wrist monitor. But the blood pressure monitors at CVS or Harris Teeter, they're okay too, and they give you sort of a general idea of what your blood pressure is, but you should check with a doctor because everybody is different. Everybody's blood pressure targets are different, sort of depending on who you are, how often you need to be checked, and things like that.
I mean, most people that either go in for a physical or women, their annual, that's when they get checked. When they're older, you said in your 20s every 2 years, right?
At least every 2 years.
So what's the next bracket of it needs to be more often? What age group?
Well, it really depends on who you are, what your family history is. Do you have other medical problems like diabetes or heart disease? Are you overweight? Are you on medications? Medications like birth control pills can increase your risk of hypertension. So there are a lot of different factors. So it's really important to talk to your doctor about how often you should be checked as an individual.
Everybody's different. And if you do find yourself in maybe a danger zone or even a light danger zone where you want to watch it, this is something, high blood pressure, that you could fix possibly on your own without having to have a drug for it, right?
Absolutely, especially in that what we call pre-hypertensive stage. A normal blood pressure is generally, we say, 120/80.
Okay.
Between 120 and 140 for the top number, we call it a pre-hypertensive stage. And above 140, that's when you really need to be focusing with a doctor in terms of getting that under control. But especially in those people who are borderline, there are so many things you can do with diet and exercise and weight loss. I mean, that's really what it comes down to. The low salt diet that I mentioned, exercising, getting your weight down, and those are things that you can do that can make an enormous difference even before you need medication.
It can help you out. Good to know. Dr. Berger, thanks for being here.
Great to be here.